mean,
Yeah.
if you're on very high doses of these medications, you've been taking them for a while, if you stop cold turkey, you can have a seizure and die.
Can you explain a little bit about benzos, please, and what
Yes.
that means?
Yeah, it's a class of medications called benzodiazepine, which to be honest are one of our best treatments for anxiety in the moment. There's
Mm.
probably nothing that I can prescribe for you that's going to make you feel less anxious than a benzodiazepine. The issue is though that long term they have risk of addiction, so you can develop a benzodiazepine addiction. There are risks of problems with cognition, problems with falling. After a certain time period, you develop dependence, and so you can have withdrawal when you come off. There are, in most cases, they're not great long-term treatments for anxiety because you develop that dependence. So short-term, yeah, they work really great, but kind of back to what we were talking about earlier, they're often not addressing kind of the underlying cause of why is the person having anxiety or insomnia? In my experience, they're overprescribed and people aren't necessarily aware of the both short-term and long-term consequences of being on them.
I mean, what I see is they take it and with a glass of wine, and I'm like, oh.
Well, yeah, the alcohol is acting on some of the same receptors that the benzodiazepine is, so it's kind of a rough combination. It's a kind of a dangerous combination. And I think the other thing sometimes that people aren't aware when they're starting medication like this is the withdrawal is can be very dangerous. I mean,
Yeah.
if you're on very high doses of these medications, you've been taking them for a while, if you stop cold turkey, you can have a seizure and die. So, like the message earlier, please don't stop your medication for
No.
turkey. I think part of the reason I like talking about this is I just think it's important for people to be aware of the potential side effects. And so when they're coming up with a plan with their provider, that we're thinking about a short-term plan, a long-term plan, and really understanding the risks of any decision.